and I'd like to welcome all of you to the meeting today. I do have a right to know sheet, script, whatever you want to call it, that I have to read before we get started. So just like to start with welcome. I am Senator Sharon Carson from District 14. Today we will be holding the regular meeting of the Oversight Commission on Children's Services. Before we get started, I'll read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As the chair of the Oversight Commission on Children's Services, I find that due to the state of the emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access contemporaneously, watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and the links provided by the General Court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call area code 603-271-3043. In the event the public is unable to access the meeting, it will be adjourned and rescheduled. Please note that all votes taken through this meeting shall be done by roll call vote. And so finally, we're going to begin by calling the attendance. When each member states their presence, also please state where they are and if anyone else is in the room with you during the meeting, which is required under the right to know law. I will now call the roll. This is Senator Sharon Carson. I am currently at my home in Londonderry, and you might see my daughter happen to walk through.
Senator Carson, this is Deli Champagne. Is it room or home? Or
it says room.
Okay, thank you for the clarification.
Okay. Senator Morgan is going to be a few minutes late. Representative Petrogrino.
He was having trouble getting on, I noticed. He said he didn't get the link.
We made contact with him and resent the link. I'll reach out again and see if he's having any further trouble.
I actually just resent it again, just in case.
I did as well.
Okay, Representative Grossman.
I'm here in Exeter at home, and I've got twin boys that are remote learners right now in the house.
Okay. Deli Champagne.
I am Deli Champagne. I am in Concord, and I am alone in my room.
Okay. Marcia Sink.
Hi, Marcia St. Casa. I am in my office in Manchester, and I am alone.
Okay. Anna Kerrigan. Okay. Joy Barrett.
Hi, my name is Joy Barrett. I'm with the Granite State Children's Alliance. I'm in my office in Bedford, New Hampshire, and I am alone.
Mary Ellen McKay.
Good morning. I am the Executive Director for the New Hampshire Foster and Adoptive Parent Association. I'm here at home alone in my office. However, I have 2 dogs and a child wandering. You may hear or see them.
Okay. Representative Altschiller.
Good morning. I am here in Stratham in my office by myself.
Nancy Rollins.
Nancy Rollins, I'm the Chief Operating Officer for Easter Seals. I'm home in my home office alone.
Okay. Judge Ashley.
Good morning. I am in my office in Concord alone.
Okay, and Michelle Wangering?
Morning, Michelle Wangren. I'm the Youth Law Project Director at New Hampshire Legal Assistance, and I'm at my home in Stratford and alone in my room.
Thank you. Is there any other member of the commission that is present whose name I did not call?
Good morning,
Okay.
Jason Taylor, Office of the Child Advocate from my office in Concord.
Okay, thank you. Okay, so Cam, we also have two people that are here that are online as well. One is Mr. Cameron Lapine. He is my legislative aide, and he will be again on this call, and Mr. Alan Raff from the majority office. Cam, can I ask you to check to make sure if we have a quorum?
Whoops, sorry. We're missing 3 members, which I believe means we do have a quorum if we're only down 3.
Okay, because we also, we do not have, and I want to thank you for sending me that list of all the members and who they represent. We are missing, we have 3 vacancies, so
Okay,
that's
give
why
me
I'm just
1 second
concerned.
to double check then.
Okay. Just for the commission members, we do have a vacancy in an individual appointed by the governor, and we also have 2 vacancies for the Association of Chiefs of Police. We have been working on those, but I think with everything that's going on right now with COVID, I think people's attention might be focused elsewhere. So we're going to continue to work on getting those positions filled. But I'm just concerned because on our agenda, we do have a number of votes that are scheduled to be taken. And if we don't have a quorum, we're going to be violating the law. So I just want to make sure.
According to the statute, you need 9 members of the commission constitutes a quorum.
Okay,
And we have 11 present.
Correct.
Then we are good to go. It's always good to check just to make sure. So I know that everyone has an agenda. Unfortunately, one thing was left off the agenda, which was the adoption of the meeting minutes that were taken on September 25th. I think that I hope everyone has had an opportunity to read those minutes, and I want to thank Representative Petrogino for taking those minutes. Is there a motion on the minutes?
So moved.
Okay, that was Mary Ellen McKay. Is there a second?
Second,
Who seconded?
Michelle.
Okay, Michelle, thank you. Okay, are there any questions? Are there any concerns or corrections that need to be made? Seeing none, we have to call the roll call. And so I will start, let me go back here so I can see who's here. Representative Grossman?
Yes,
Okay.
I approve the minutes.
Deli Champagne,
Yes.
Marcia Sink,
Yes.
Joy Barrett,
Yes.
Mary Ellen McKay,
Yes.
Representative Altschiller,
Yes.
Nancy Rollins,
Yes.
Judge Ashley,
Yes.
and Michelle Wangeren.
Yes.
Okay, and Senator Carson, yes. So we have adopted the minutes. One thing we do need to do is we need to have somebody be the clerk to take the notes. Is there anyone who would like to volunteer to do that? Everyone's quiet. That's the one job nobody likes to do, is to take the notes. Cam, can I ask you to take the notes for this meeting?
Sure, I will take the notes for this meeting.
Yes, for this meeting. We'll work on getting a clerk for the committee for the next meeting. We'll try to get that done ahead of time. Okay, so we have a couple things here. First is the election of a vice chair. Is there anyone who would like to move their name forward, or is it anybody would like to nominate someone to be the vice chair? Hi, Marcia. Are you volunteering?
No.
Okay.
No, but I would bring Nancy Rollins' name forward as the former vice chair. I think she did a terrific job in stepping in and covering when necessary. And so I would put Nancy's name forward if she's not in objection to that.
Okay. Is there, I see Joy. Joy, you have your hand up?
I would echo that same thing. I would like to also support Nancy Rollins as vice chair.
Okay. Are there any other names to come forward? Okay. I'll just let members know Senator Morgan has joined. Good morning, Senator.
Good morning.
If you could tell us, state your name and where
Yep.
you're located.
Senator John Morgan in Exeter, New Hampshire, and very obviously not alone in the room. I have my kindergartner on virtual school right behind me.
Okay, thank you very much, Senator. What
Senator
we're doing
Carson,
right now.
Also, I'm sorry to interrupt. Senator Carson, it also looks like Representative Petrigno is here now.
Oh, Representative Petrigno?
He's muted. I've asked him to unmute himself. I see him there. All right, maybe he's not actually there. I'm sorry.
Okay, not a problem. Senator Morgan, we've already adopted the minutes from the meeting on September 25th. What we're doing right now is we are electing a new vice chair for the commission. Nancy Rollins has been nominated by 2 individuals. There's been no other names that come forward. Are you ready to cast a vote?
In support of Nancy, of course.
Okay, terrific. All right. Again, because of the right to know law, this is a roll call vote. So I am going to go ahead and call the roll. Okay, Senator Morgan?
Yes.
Okay, Representative Grossman?
Yes.
Dealey Champagne?
Yes.
Marcia Sink?
Yes.
Joy Barrett?
Yes.
Mary Ellen McKay?
Yes.
Representative Altschiller?
Yes.
Nancy Rollins?
Am I supposed to recuse myself from the vote?
I'm not sure. I just figured I'd call your name. Just
Okay, well.
Okay. Judge Ashley
Yes.
and Michelle Wangren
Yes.
and Senator Carson, yes. So we have now elected Nancy Rollins to the position of vice chair. We congratulations.
Thank you.
We also have the election of a new clerk. Is there any names to come forward? I know no one wants to do the job, but we must have a clerk. No one wants to do this. Maybe, why don't we do this? Because I have volunteered Mr. Lapine to do the minutes for today's meeting. Why don't we elect a new clerk when we meet? And I'm hoping that we can meet in late January of next year. So if we can hold off on just electing a clerk, I think, what do you folks think? Do you think that would be appropriate? I see everybody going yes.
Maybe,
Okay.
Senator, maybe your chiefs of police candidate will volunteer to be the clerk. I'm kidding, sorry.
Well, we've got to get somebody who will do this. So, okay. We're going to go to the next agenda item, which is the DCYF updates. And I see Mr. Rippson is here with us this morning. Good morning, Mr. Rippson.
Hi, good morning, everybody. Joe Rippson, Director DCYF. I'm alone in my office in Concord. Great to see everyone. Have a few things that I wanted to share today. And, as usual, when I speak to the group, I'm totally open and prefer actually if folks, feel free to ask questions kind of as we're going through stuff instead of waiting for the end, because oftentimes I find the questions are best addressed kind of in the moment with the, the data and other things that are in front of us rather than trying to back up and figure it out. The couple items that that were suggested that I shared today, and I'm certainly open to talk about anything that folks would like to talk about, was taking a look at kind of the data related to what COVID is what impact COVID is having on the system, and to talk a little bit about that. I also really wanted to talk about a very exciting new development yesterday when Governor and Council approved a very large contract for community-based voluntary services that I think is going to really fundamentally change the way that much of child welfare in the state works. So that's super exciting. I wanted to spend a little bit of time on that. And then if we have time, I can also give a little bit of a preview of the data that'll be in the data book when that gets published. I'm kind of embarrassed it's not published yet, but I do have the data available. It's just not in its final format. So I can preview some of that for the group if we have time. And if we don't have time, then we can certainly put that on the January agenda. And assuming that sounds okay to folks, I'll jump in. I know we need to save time for the child advocate as well.
Okay.
What I'm pulling up here, just so folks can look at this anytime you want. This is the DCYF page, not the prettiest. The state's working on redesigning all the websites, but there's a link here called Trending in DCYF Data During COVID-19. So this is public facing, and if you can look at this anytime you want. If you click that link, you'll see, in the early months of COVID, weekly reports, and then we shifted to a bi-weekly cadence over the summer. Most recent one's November 12th, so I'm going to just pull that up. And I'm assuming everyone can see this. Yes, that's great. So the first thing you see here, this is volume of calls to our central child protection intake. That's the child abuse and neglect hotline. The blue line is 2020, the orange line is 2019, the green line is 2018. And the reason why we show this is that it demonstrates kind of what we're seeing today compared to what we see in a typical time period. And I do want to qualify that a little bit. 2018 and 2019 are not typical compared to prior years in the system. 2018 and 2019 were both record-breaking years for calls to intake, actually record-breaking years across the system in terms of volume. So they're not really the ideal baselines, but they still are, I think, reasonable recent comparison points to kind of see what was happening in 2018 and 19 compared to what's happening now in a post-COVID environment. And this chart doesn't start until you see here May. If you pulled up the earlier charts that I showed you that list, you would see this going back to prior to the COVID period. And what you would see there is that 2020 was pretty much tracking along 2018 and 19, a little bit less than 2018 and 19 in volume. And then when COVID hit, it really collapsed the call volume. And you see kind of the tail end of that here through May, right? So if you remember in May, schools were still closed. But on top of that, people were really not engaging in the public forum in the way they typically do, right? Not going to doctor's appointments, not going to, camps and school programs and other activities. What we did see was call volume over the summertime started picking back up. And in a later chart, we'll actually see who the callers are, so you can kind of understand that a little bit better. But in the summer, we really were seeing call volume along typical ranges. And that's because in the summer, every year, schools are closed, right? So what we were really seeing over the summer was school call volume being what it typically is, which is very, very low, right? We have some summer schools, some camp, some daycare that fall into that category, but other callers kind of returning to typical levels. And then when schools reopened, you did see this jump up to well above where it was ever during the COVID period. Not quite as high as it was in 2018 and 2019, but back up into somewhat typical ranges. And then over the last month-long period, so these are 2-week chunks, just to be clear, we saw it dip down some, but not back down to the pre-COVID levels. And I think a lot of people, and you'll see when we get to the later chart, kind of assumed that maybe the schools made a bunch of calls and then stopped. But what we actually see is it wasn't the schools. The schools are reporting at the same rate that they were in these 2 weeks or in these 4 weeks as they are now. It was actually our other callers that started to dip. This is the same data, but just by new assessments that are coming in the front door. So you do see the new assessment volume also down, corresponding along with call volume, actually maybe a little bit steeper than that for reasons that I'll talk about a little bit later, given some of the changes that we've made around how we screen assessments and how we refer families to other services out of intake, which is a practice that we didn't previously have. So actually, I'll just talk about it now since I started to. Earlier this year, a little bit prior to COVID, we started working with our intake staff around not just being a binary intake system. So historically, if you called the hotline, you had there were two responses you'd get. You would get, yes, you're getting screened in. No, you're not getting screened in. And that was the end of the conversation. We've been working with our intake folks to have a third option, which is that if this is a situation that doesn't really rise to the level of abuse or neglect, but there's a family who we think could benefit from help, to help those callers connect those families to other resources. And we piloted that in 2 different areas. One, around connecting families to home visiting services if they have young children, or if this is a pregnant mother. We'd often get calls about a pregnant mother who maybe had a substance use challenge and they were concerned about what would happen at birth. We can't screen those in as a matter of law because there's not a child there for us to investigate, but we can certainly connect those families to home visiting programs and hope that that Healthy Families America home visiting program is successful in helping that that mother, so that when that child is born, that she's, you know, hopefully overcome her substance use disorder and hopefully in a better position to support that child and have a healthy birth. Similarly, a lot of the families that we get calls on are, you know, it's not for the kind of egregious abuse types of things that people think about, but it's around issues of, you know, kind of generalized neglect, which are oftentimes just, you know, a euphemism for challenges that come along with poverty. And in those instances, you know, a child abuse and neglect investigation isn't always the best intervention. You know, we are scary people as much as we try to be engaging and supportive. Nobody is welcoming a knock on the door from a child protection investigator. And for some families, that's the kind of thing that could make them more fearful of interacting with the system. So the idea is that if we get an allegation that doesn't quite meet that threshold of abuse or neglect, but which we think is concerning because of these poverty type of issues, to try to redirect those to family resource centers and have those kind of helpful services intervene and hopefully prevent that family from coming back into the DCYF system. So as a result, we've actually seen at intake some shifts around not only call volume, which is part of what you're seeing here, but also in screening practice. So we've actually our screening rate has gone down a little bit as a result of the shift in practice, which I see as a good thing. It's about redirecting families to the right service, but it does result in a smaller number of families getting screened in. And I'll pause because I just said a mouthful and I don't know if anyone has questions. I think you're muted, Senator.
Joe. Oh.
Sorry, the dog is barking. Joe, one of the things that we've looked at in the past and we've talked about is as we're going into the holiday season, we tend to see an uptick in the calls. Are you predicting the same thing for this year?
You know, it's interesting. We actually see, typically in a typical year, you'll actually see call volume slow down in November and December. And it typically is school call volume that slows down in those 2 months. The busiest months for the Child Welfare Agency for new calls tends to be late September and October, and then again in March. And it's driven mostly by school callers because they're the highest volume caller by far of anybody, followed up by law enforcement. And I think the theory is, and this isn't just a New Hampshire phenomenon, this is national. You see this in every child welfare system across the country. And the idea is that we think what happens is when kids are returning to school, teachers are discovering new things, learning new things, hearing new things about what might have happened over the summer. That increases call volumes. Then towards the end of the school year, you kind of have the opposite, where teachers have seen these kind of persistent things over time. They're getting more anxious with the school year coming to a close and want to make sure that that child's going to be safe going into the summer. I don't have research to back that up, but that's been kind of the underlying thinking behind what we see there. Where you do see increases in the wintertime, though, are around issues of challenges with substance use sometimes, challenges with mental health issues sometimes. A lot of those types of challenges with families start to pick up during the holidays. So while the total volume might not increase over the holidays, the types of cases that you see during the holidays sometimes shift a little bit.
I have a follow-up question, Joe. We know that because of COVID, people have lost jobs and people are having a hard time getting up on their feet. And we're really starting to look at the issue of homelessness. Do you think that homelessness is going to play something, or I don't want to say key, but do you think that it's going to play a role here as well?
I'm sure it will. Housing instability is one of our #1 drivers of calls. Really, it's things, mental health, substance use, housing instability. Those are the high volume things. Obviously, we think a lot about physical abuse and sexual abuse, which are incredibly important, dangerous things to be worried about, but not actually the highest volume things that we see. The highest volume things often tend to be linked to those poverty type issues, which with housing instability is one. Another high volume type thing that we see a lot of is domestic violence. And I actually have data in a couple slides that talks about that. So
okay,
well, going deeper into that until we get to that slide. Anything else on this? So what this is, and again, if you go back, this is only showing the last, handful of 2-week periods. But if you go back in those prior charts that I showed everybody on the web, you can see this going back to the start of COVID. What this chart shows is all the way to the far left here, this is what a typical 2-week period looked like in 2019 in terms of call volume. Each of these colors represents different kind of caller types. The dark blue are the school, yellow is law enforcement. You see that's another really big one always. This light blue is mental health. That tends to be a pretty big one. This bright red is, parents, guardians, family members calling about things happening within their own families. This pink is medical. But those are kind of our highest volume callers in a typical 2-week period. This is a typical summer, or this is actually 2019 summer. So that people could compare what the summer looked like to the summer looked like the rest of the year. And then here's what we saw during those 2-week periods from August through now. You do see that once schools started picking back up in mid-September, the school call volume did jump quite a bit. And what I think is interesting is in the last couple of weeks where we saw the volume drop, the schools actually maintained, and there was other caller types, medical, law enforcement even, which is typically pretty steady, who were reporting a little bit less. And I don't know exactly why we're seeing that. I could speculate that maybe it's because, with COVID numbers picking back up, people are being a little less apt to go out into the world than they were. And as a result of that, maybe some of these other callers who have to be seeing kids to be able to make referrals, maybe are not seeing kids as frequently as they were, which is certainly a phenomenon that we saw at the beginning of COVID. But what we're not seeing is the schools falling off yet, even though a lot of districts have started, combination of hybrid, some remote, some in person who have then scaled that back, but we haven't seen the school call volume drop. A lot of folks that are on this call have been engaged pretty readily since the start of COVID to try to think about these issues and try to work on these issues, try to bring attention to these issues. Marty Sink, Joy Barrett, Moira O'Neill have all been part of this group that meets with a host of other people that meets every couple of weeks to talk about these issues. We've done a lot of partnership with DOE, did a couple webinars for teachers and other educators to talk about these issues. Joy's Know and Tell has put out some specific materials for teachers reporting in a remote environment. So, folks are really trying hard to make sure that we're hearing about all the things that we need to hear about, even though reporting is harder when people aren't putting eyes on kids in the ways that they typically do. I don't know if folks have any questions about any of this, or if Marty or Joy or Moira might have anything to add to that conversation since they've been parts of this work. What this shows is the same data, except it's just showing month to month, right? So this is May 2019. You see how high that volume is. May is one of our busiest months of the year compared to May of 2020 and that huge drop off, and a big chunk of that being schools. But you'll see, right, medical providers, mental health. The only one that really kind of stayed steady are law enforcement stayed pretty steady through last May, and calls from parents, relatives, et cetera, stayed pretty steady last May. But most other caller types really fell off last May, which was kind of the peak of the start of COVID. And what we're seeing now that we're entering this kind of new peak of COVID, it's not quite as stark as it was then. right? It's not typical, but it's not quite as stark as it was then. Largely driven, as I said before, by schools who, if you look at May of 2020 compared to October of 2020, you're getting about twice as many reports in October 2020 than we did in May 2020. So even though they're remote, the schools certainly have figured out ways to get better at identifying and reporting than they were in the springtime.
Joe, this is Deli. I'm just curious, who would be in the other category?
Yeah, it's, and I don't have that in the appendix of this slide deck, but we get calls from all types of people, right? It could be just a neighbor or community member. It could be, we get calls from, other, people who, mailman or who's delivering the UPS package, or all kinds of folks, right? So pretty broad.
Somebody who's working at the grocery store might see something in the parking lot or something like that. Okay.
Exactly. All kinds of stuff. Yep.
But in this, and correct me if I'm wrong, Joe, also under community agency, I mean, boys clubs, girls clubs, but that other is typically people in the community.
That's right.
And I have to say that, talking with our school district here, but also the school districts we work with, I know that they have done an incredible job of, in their Zoom and, in-person contact, I think doing an exceptional job of really making sure that kids have everything they need. It goes along with the food insecurity, the fact that they were delivering meals and all the other kinds of things, but they're very conscious of that in their meetings with kids, both one-on-one as well as group meetings. Absolutely, yeah. I mean, I could personally attest that what I'm seeing out of Concord district with my own children is very different now than it was in the spring, right? Right now, they were doing hybrid for a while. When they're remote, they're at least seeing their teachers almost all day, every day via Zoom, whereas in the springtime, it was kind of like, here's a homework packet, we're gonna check in once a week. So we're certainly seeing, I could say, at least in Concord, a big difference. And I hear that all around the state. And DOE's taken this very seriously. I've been very, very impressed with how much partnership they've brought to all of this. They actually joined that bi-weekly work group with us that I mentioned that Moira, Marty, and Joy are part of. They put together those webinars that I spoke about. They've pushed materials out for us. They partnered with us this summer. We created that well-being guide to try to help people identify families in need and connect them with resources. They included that well-being guide, at our request through our conversations with these big kind of help packets that were distributed this summer to families, 25,000 families across the state with the help of the National Guard. So they've really been taking this seriously and trying to be great partners. I do have to say, I don't hear that in other jurisdictions. I do meet with New England Child Welfare directors every 2 weeks now through the COVID period. And you don't hear that same level of partnership everywhere else.
Joe, if I can just add to that DOE partnership, one of the things that they put out was a lot of guidance to school districts about absenteeism, because of course it was the kids that you weren't seeing in Zoom or in some of the online learning, and all the school districts have an MOU with their local law enforcement. So there was a lot of safety checks that were happening with that partnership. Because if something didn't rise to them feeling the need to make a report, right, there was the only way that they could have a safety check done really was by contacting law enforcement and having that happen. And so there was a whole effort in doing that. Actually, Marty and I spoke with a couple of superintendents around that, and they really did step up to the plate with providing a lot of uniform guidance around the state. As Joe has mentioned, it was a good effort, and I think it kind of got people in a pattern of doing that as these ebbs and flows are happening with kids not in the presence of an educator or in school, that they're continuing those actions.
Absolutely. Thanks, Joe. The next slide gets a little bit into the topic that we were talking about, Senator Carson, that you raised. And actually the data here has shifted a lot over time. So if this is one that if you pulled up the springtime data, it would look totally different than it does right here, which is surprising to me, actually. Let me explain what this chart does. And then, some of you might be interested in going back and looking at the springtime data to see these shifts, because they have been pretty shocking, at least to me. What this shows is each of these bars is within this 2-week period, how frequently was this call type, this allegation of abuse or neglect made, right? So caretaker substance use, And then this red line here is the 6 months prior to COVID. How frequently was that made? And the green line was in 2019 overall. How frequently was that call type made? So what you actually see is caretaker substance abuse as an allegation type is actually down right now as a percentage of our overall calls, which is really surprising to me because it doesn't align with everything else that we're hearing about substance use in the community. And it's also surprising to me because what we saw in the springtime was the exact opposite. These bars were way up here, way above what we typically saw. And I know the folks who have looked at this regularly with me every 2 weeks have seen this shift over time. But that one is surprising. Inadequate basic care, which kind of captures some of the things you were talking about, Senator Carson, some of those poverty-driven housing instability. This one actually during the start of COVID was really low. And now it's been above or at least near the averages from the prior years. And that shift really started at the start of August, where it went from being way below normal to starting to jump above normal, which does correlate with some of the shifts around extra financial support being provided to families and things like that. Physical abuse actually has remained relatively low as a call volume type compared to prior years across all of COVID, with the exception of that 1-2 week period, which is kind of a blip when you look at the overall trends. Threatening, menacing behavior, it's another kind of typical one that we get. That one's been pretty consistent but relatively low. Lack of supervision really spiked also in the spring as a call volume type, that we typically didn't see in the springtime. And that's kind of come back down. And then domestic violence was one that actually during the spring and almost all the summer, you see the tail end of it here in this early August data, but this is one that was way above normal through all of COVID. And for the past couple months has kind of fallen back into typical ranges. But this was a call type that we were getting an awful lot of prior. So I think, right now, like I said, this data doesn't look quite as stark as it did in the springtime, but it is still something we want to keep an eye on to see if there are certain areas that we need to put more attention to the system.
Okay.
This is the JJ data. So this is new JJ cases opening up. You see that's been relatively low compared to the typical prior 2-year period. It started to pick up as schools reopen. There's a lot of JJ incidents originate with school activity. So when the schools are closed, you see over the summertime, those things tend to be a little bit less. But we do see that picking up a little bit, but not up to the typical levels. Child protection cases, a little bit different. So child protection cases, despite the reduced call volume and despite the reduced assessments, we're actually seeing the number of new cases open stay within a typical range. And just to be clear for folks, what a case is when we've investigated, we found that there's abuse or neglect, and most instances have decided that we need to go to court to address that situation with the family. Sometimes they're voluntary, but typically these types of cases are not voluntary. These are times that you have to go to court. And as you see here, we did see a drop in the springtime. If this chart went back further, if you picked up the old charts, you would see there was a big gap here. But really since May, we've seen kind of case volume stay within this typical range, despite the fact that call volume is down. And I hate to overread into some of this data, but it gives me some comfort that we're seeing case volume stay steady during this period that call volume is down, because it suggests to me that hopefully we're seeing the types of higher risk things that we would typically see. If this number was really low, I'd be really worried that we were missing a lot of stuff. But given that this is staying within typical ranges, I'm a little more comfortable that hopefully we're seeing the high risk things that we really need to see. And I know, I've had some conversations with Joy and Marty in that group about this a couple times. I know what Joy and Marty are seeing in their pieces of the system, right, with child advocacy centers and doing interviews of real high risk kids, and Marty with the CASA advocates in the court cases, is that at least since the fall time, it seems that they're picking back up to typical levels too, despite the fact that our call volume isn't quite where it typically is.
Yeah, Joe, we just looked at our data this morning, and in fact, that's accurate. We're pretty much where we were last year at this time. So,
Joe, are all your assessments, are your field staff all doing in-person assessments and work with families?
Yeah, it's still a bit of a hybrid. We shifted it in May. So at the very start of COVID, we went to going primarily remote and virtual, only going out if we couldn't accomplish what we needed to accomplish virtually. And I wasn't thrilled with that. I wasn't really comfortable with that, but there was so much, one, we didn't have PPE for our staff at that point.
Yeah, understood.
Two, and two, there was just so much unknown that we were being really cautious. We shifted that policy in May. So actually this jump that you see in new cases,
yeah,
you had the chart that goes back further, you would see that this jump actually occurs at the time that we shifted our policy to go out more often.
Understood.
So we still allow staff to do remote if it comes in as a real low risk situation and then assess based on their kind of, remote intervention as to whether or not they need to go out. But we are requiring them to go out in person for more high risk situations. And in those instances, we've provided a lot of guidance around how to try to do that safely, right? Trying to use outdoors when possible. I know that's going to get harder as the weather gets worse over the winter. Only going in the home for the extent necessary to understand whatever the driving issue is, right? So if there's complaints about the conditions of the home, you certainly have to go in. But if you just want to interview with a family member, you can go to the door, you can see them, assess them visually, and then go back out to your car and conduct the rest of your assessment, the rest of your interview via Zoom. So you're limiting your in-person time. And of course, now having full PPE available for folks, which wasn't available in the springtime.
Great, thank you.
Yeah.
Senator Carson, I'm sorry. I was just going to point out Representative Altschiller has her hand raised.
Oh, okay. Representative Altschiller?
Thank you. Joe, if we go back one slide, could I just ask you for a clarification? Oh, maybe one more slide before that. Yes, this one. So clarification on the two categories. What is the differentiation between categorizing physical abuse versus domestic violence?
Yeah, so physical abuse would be physical abuse directed at the child, whereas domestic violence is typically more characterized as that intimate partner violence, that type of, really between the family, between the parents that the child's being exposed to. I know that certainly those concepts can be kind of, overlapping in a lot of instances, but that's pretty much how we try to differentiate that.
Okay. It just between the two, I'm not seeing that. It doesn't seem to track though, because I'm looking at the week of 9/13 through 9/26 for physical abuse. There was a 20% spike.
Mm-hmm.
And it seems like domestic violence would be 9% down. And those are, I don't know. Could you tell me why they're not co-occurring and where's the dividing line where you categorize one into one space and one into the other?
Yeah, so an allegation that comes from the physical abuse category would be an allegation of a parent abusing a child, committing a physical act against a child. Whereas an allegation of domestic violence would typically be that intimate partner violence, a parent committing an act against another member of the household, typically their partner, where the child is exposed to that. So they're capturing different things.
Gotcha.
So sometimes might overlap, right? You might have a case that has both of those allegations. In fact, it's not all that infrequent that you do see both of those things happening together.
Exactly.
Different things.
Yeah. Okay, well, thank you for the clarification.
Yeah.
I have a question.
Yes, Judge.
Thank you. Just to follow up on that. So, Joe, are these categories the primary categorization when the call comes in versus, if there are two or three issues, which obviously often there are multiple issues. So when something is falling into the category, it's only counted once. So it's falling into the caretaker substance abuse, even though there may also be inadequate basic care.
Now, actually, what this does is it's capturing all of the screened in allegations. So you could have a call that has 3 or 4 different screened in allegations, or you could have a call that just has one screened in allegation. So it's capturing all of the allegations.
Great, thank you.
Are there any further questions?
wanted to just quickly hit this, and I know I'm pushing on time, so we can put some of this on a future agenda too if we want. This is juvenile justice data. So you saw the here the juvenile justice cases. Right, every time there's a juvenile justice case, that doesn't mean a kid ends up at SYSC or in a residential program. That's what this is capturing. How frequently we're seeing those juvenile justice cases where a youth is being referred to some type of outside of the home intervention. On a rare occasion, that's foster care, but that's very rare. It's almost always a residential program, and to a lesser extent, SYSC. And you do see here a huge gap between what we were seeing in 2020 compared to 2018 and 2019. Part of that, I think, part of it's because of challenges that the residential system is having, and part of it's due to some intentional activity on the part of our juvenile justice staff to try to reduce the utilization of congregate care settings where possible, given what we're seeing through COVID, right? Congregate care settings are by far the place where, when we see COVID exposures, where we're seeing them. At this point, we've had roughly 30 youth involved with DCYF who have tested positive for COVID, and almost all of them have been in congregate care settings. In the springtime, only a couple in New Hampshire, most of them in out of state, but now in the second surge in the fall, we're seeing more within the state of New Hampshire as well. So that's certainly a concern for us. On the JJ side, they've done a really good job, I think, to try to minimize the use of congregate care where they can. Child Protection's had a much harder time. And I think the real shift there is that on the JJ side, typically there's at least there's a safe home for a child to return to, where on the Child Protection side, oftentimes residential care is being used because we don't have a safe home for the child to return to, and we don't have a foster home that's ready and able to serve that child. So those are some underlying systems problems that we've been working on for years, and COVID is kind of exacerbating some of those challenges. And I don't know if folks have anything about that before I move on to the child protection removals. All right, and then child protection removals, you'll see these have been a little bit on the lower side, but not way out of what's typical. And I hope what we're seeing here, what I believe what we're seeing here on this being on the lower side, but not totally out of what's the typical range, is that we've really been working hard with staff for a couple of years now to try to support families and keep kids intact in their own homes if we can put a service in place and keep that kid safe at home rather than remove them. So you see, we certainly still are having kids enter foster care, but it seems to be at a slightly less pace than what we've seen in the last couple of years. And I don't think this is a COVID shift. I think this is a shift around the practice that we've been trying to do with families for quite a while now. Say that is that, as we saw before, right, the new child protection cases, so these are all instances where removal might have occurred because we think it's serious enough to go to court. The new cases are still a high level, right? They're still in kind of that higher typical range, but the removals are kind of at the bottom end of that typical range in most weeks. So that's what we're seeing on the removal side. Any questions about that? That's the end of the COVID data. So I'll take any questions folks have.
I have a quick question, if that's okay.
Yes, please.
With the child protection removals, you said that that's been a little bit more complicated than the juvenile justice removals. Are the barriers to finding those children homes in the community-based settings, are those COVID-19 related barriers, or are they more longstanding barriers?
I think they're more longstanding barriers around the number of foster homes that we have and what they're licensed for. You know, we have a lot of foster homes where folks are, you know, looking maybe just to adopt, you know, healthier young kids, or foster homes that are looking to serve, you know, younger age groups. I think if I'm really, you know, if I really have my wish list on what we need around the foster care system, it's, you know, foster parents who are willing to serve older youth, foster parents who are willing to take large sibling groups in, foster parents who are really, you know, supported to be able to work with children with different types of disabilities, you know, mental health challenges. I think, you know, that's been a real tight part of the system that we're working on, but has always been tough. And I think within the context of COVID, it's just kind of shown a light on how tough that piece of the system. You know, recruiting activities have looked very different since COVID, right? There's not a whole lot of in-person recruiting activities, which is typically how we recruit. the typical way to recruit for foster care is to go to places where families go, because those are typically the people who sign up, people who've had kids or who've served as foster, who've served as, who've been parents in the past, or, that go to places where families go. Those are typically the people that sign up to be foster parents. And so a typical way to recruit is to go to those places. And right now there's not a whole lot of opportunities to do that. So we've tried to push out more, messaging, more advertising. There's billboards all over the place. We had partnerships with coffee shops to put, sleeves on their coffee mugs that talked about foster care recruitment. We have all kinds of signs and car magnets and that kind of stuff, but it's definitely different than the typical way of recruiting foster parents. And I think, that being said, we had just last night, Mary Ellen McKay was there at, an adoption day celebration, a virtual adoption day celebration, which was really awesome, and heard from a young woman who was adopted at age 19, which is, not typical, but is awesome. And to hear her story about how much she longed for a family and how she managed to find this family that was just perfect for her, and to hear her family share that story as well, was really, really remarkable, really touching. So there are awesome people out there willing to do all types of great, awesome things, but sometimes making that connection is hard. And that family, when they shared their story, they saw this young woman on the New Hampshire Chronicle and the MUR, and just, fell in love with her, and didn't anticipate that they were going to adopt, and they fell in love with her on that show. So I think you can use other ways, but it's hard. And it's something we're struggling with.
Are there any further questions for Mr. Rippson this morning?
Just a quick,
Marcia?
Yeah, thank you, Senator. Joe, just a quick comment, and we're always in a recruitment mode as well, as you know, and we've been doing a lot more on social media, which has been wildly successful, Facebook ads and things like that. So that might be another vehicle that you could use. We are also doing virtual information sessions, so people can zoom in and learn more about CASA, and those have been incredible. We had 80 people sign up for one recently. So anyway, just a few tips.
Awesome.
We can talk more about that another time.
Joe,
Yeah.
I'm sorry, Joe.
I was just gonna say, if we have time, I can pull up some information on the community-based voluntary services, or if I'm pushing time, we can move on to, we can put that on another agenda or whatever the committee prefers.
I just had a quick question for you on the data. As you know, we're I guess you could say in the middle of a COVID surge. And what do you think is going to happen with that data? Do you think that the data is going to radically change, or where do you see the changes coming into play?
It's hard to predict, because what we're seeing right now, at least on the reporting side, is really different than what we saw in the spring. So I don't think we're going to see a repeat of the spring, because people have somewhat shifted and figured out how to do some of this stuff, remotely or without as much physical presence. I think what we're probably seeing in those last couple week periods where the dip is probably something that will continue. And my theory on that, and I'm not sure, it's just my theory on it, is that as people are going out in the world less, as they will go out in the world less in the coming month or so, that there's going to be less opportunities for adults to put eyes on kids, which is going to drive down reporting. As we've seen so far, that hasn't impacted the schools as much, because it seems that they figured out how to operate remotely somewhat, and be able to capture information. But other types of settings, medical, for instance, where we've seen a pretty steep drop in those past couple of weeks. I would expect law enforcement will probably stay around where it has been. They've been pretty steady throughout all of COVID. But medical, mental health, those are really high call volume sources that I would expect to see slow down. As far as deeper into the system, I think, and again, this is just speculation, I don't know. I would expect to see some of that allegation type stuff shift again. I would expect to see some of those pressures around substance use and some of those pressures that lead to domestic violence start to pick up again, unfortunately, the way that we saw in the springtime. So we might see some shifting in the types, in the call types, as opposed to the call volume. And then, as far as kids coming into the system and coming into care, I kind of think the system's figured out, how to function in this way. So I don't expect to see any big shifts there, but obviously that's something I'm going to want to keep an eye on, especially that new case number. If you start seeing that new case number really fall low compared to what's typical, then it makes me worry that we're not seeing things that are high risk that we should be seeing. So again, in my mind anyway, there's a bit of a distinction between the calls we're getting and the assessments we're doing, and then the things that actually open to cases, right? The things that open to cases are the high risk situations that we would have always wanted to address, more intensely. And that's when I worry about, if I see those fall low, like we saw in the springtime, I'd be worried that there's a lot of stuff there that are in really scary situations that don't have, that aren't getting the support that they need.
Okay. I do have a follow-up question, Joe, and then I see that Joy has her hand raised. We're starting to hear about kids and mental health issues because of COVID. Have you seen that? I mean, it looks like it's pretty consistent right now across the charts, but do you think that we're going to see an uptick in the need for services for kids with mental health issues?
I would assume so. And I base some of that not just off of what we're seeing in COVID, but off of my experience working in a post-crisis situation in New Jersey following Superstorm Sandy, where in those communities that were really devastated by the storm, where neighborhoods were torn apart, families were separated from everybody that they know, we saw real increased referrals to our children's system of care, which is our behavioral health system for kids from those communities. It's one of the things I worry about, as a long-term recovery from COVID, as much as I think about it within the framework of what's happening today, right? It's this next couple of months, but it really is something that lingers on well beyond as people start to address the trauma that they've experienced. And so that is something that I think, we need to keep our eyes on going into, not even just this next couple of months, but the next couple of years.
And Senator Carson, Senator Carson, this is Deli Champagne. I'd like to add that I work for New Futures, and we have a committee that's been put together to look at the high ER boarding numbers for kids. And I know Dr. O'Neill her office is a member of that committee. So it is being looked at, and NAMI's on that committee with some possible outcomes to be recommendations to the governor. So those of us in the advocacy world are looking at those high numbers and hoping to have a solution or some ideas to get those numbers down soon.
Okay, thank you. Thank you, Joe. Joy had her hand raised.
Yeah, mine isn't necessarily a question, but just a comment regarding sexual abuse and what COVID has provided as far as challenges around that. Sexual abuse is usually a disclosure that's made by a child, to an adult, usually, again, someone in a child-facing organization or in a school. And we saw in this particular fall at child advocacy centers, we saw a lot of delayed disclosures once kids went back into school. So again, some of the unsettling kind of movement with schools closing and opening creates that to kind of shut down again. You probably noticed that one of the classifications of type of abuse and neglect that wasn't presented wasn't sexual abuse. And Joe and I've had this conversation that the intake numbers are just so small that they don't rise to even making it into the data. So I just wanted to kind of, make sure that, people on this particular commission were aware that is, that's a challenge for these kids. Some of them may never disclose, what has happened to them through this period of time. And so, that's a huge issue.
Marcia?
Yeah, if I could just add to that, I think in addition, so many of our kids who do disclose sexual abuse come into our system for other reasons first, and the disclosure comes later. So they may be coming in for neglect or any other reason. And then it is several months till they're comfortable enough in their foster placement or with a relative placement to be able to disclose sexual abuse. So.
Okay. Are there any further questions or comments for Joe this morning? Seeing none, thank you, Joe. I think when we meet, have our next meeting, I'd like you to discuss the community-based grant that you just received, and perhaps to get some sort of update on Families First and how that's going. Hopefully the legislature will again be up and running, and maybe we don't have to Zoom the next meeting. Maybe we can actually meet in person, but we'll have to wait and see. But again, thank you very much for all this information. I think it's been very, very helpful for us to hear, so we can plan for the future when we're coming out of this crisis. Okay.
I'm sorry, just really quickly, I also need to be at the Joint Fiscal Committee meeting now, so I'm going to step off briefly, and then just wanted to, just explain why I'm stepping off. And
it's okay. We find ourselves, this happens. So again, thank you very much, Joe, and hopefully you can jump back on after the fiscal meeting.
Thank you.
Thank you. Okay, Myra, let's hear from the Office of the Child Advocate.
Good morning. Thank you, Senator Carson. Hello to everyone on the commission. Joe is a very popular guy this time of year, so it was good to be able to hear all of those reports from DCYF. There's an awful lot going on the past couple of weeks. We've actually lost our breath trying to keep up with some of the developments. But we did release our annual report, and I assume everyone received a copy. We did make some hard copies. If anyone wants a hard copy of it, just let us know. Get in touch with me or Karen, and we'll send one out to you. Sorry that we can't be together and hand them out. I'll just say just quickly, we focused in that report this year really on our workload and what we were doing so people could understand the office. We didn't focus too much on particular issues because we're going to see those in other reports that we'll be putting out and that we have put out. But just as a quick sort of summary, what you would have seen if you read the report in the last year, starting October 1st, 2019, ending September 30th, 2020, we received, reviewed, responded to, and monitored 2,182 incident reports and 312 citizen complaints. We conducted and reported 14 comprehensive individual child case reviews. We conducted brief reviews and analyses of 18 child deaths. We facilitated 3 system learning reviews of critical incidents with teams from DCYF. We conducted 10 critical incident reviews with summaries of child and parent deaths, missing children, near-death incidents, and domestic violence. We embarked on 3 facility reviews and monitoring of DCYF special investigations of facilities. We've led the working group on juvenile justice with an aim for reform of that system. We published 1 issue briefing about COVID-19 quarantine needs. We provided legislative advocacy and testimony and consultation. We participated in 30 events of outreach and education, and we participated as active members of 14 committees or advisory groups. We did a lot of work last year. And I was also asked today to talk about observations on children's services. So I think from all of the work we did last year, I can speak a little bit about some of the issues that have come up and that we're going to continue to work on. But first I'll mention when we last met, I talked about the expansion of our jurisdiction, the changes in RSA 21V, and we've started to essentially do a system inventory of children's services. So we have a sense of what our oversight is and where we can start building partnerships. We had a very good meeting with Commissioner Edelblatt at Department of Education. It turns out they have some good infrastructure already for sort of oversight mechanisms and opportunities for partnerships. So we'll be meeting with his team to look more at how we're going to be able to work with them. We have slowed down with introductions in other DHHS divisions and bureaus and programs. Commissioner Shibonet is conferring with the Attorney General about exactly what our authority is. And so we haven't been able to get any information about, who to contact and where to go to either get information or share information about our role. So we're working on that. In the work that we did over the past year, there were several themes that we're going to hope to dig a little bit deeper on this coming year. Because of the expanded jurisdiction, we think we'll be able to see the picture a little bit more. And one of them is institutionalized children or children who are at risk of being placed in residential settings or at the Sununu Center. These are the most complex cases. And we're seeing in a lot of them that they tend to be crossover cases. And we talked about this a little bit in the annual report. So most of the individual child case reviews that we did in the past year and continue to do are children who have considerable history with DCYF. Most commonly, they were children that came to us because they were at risk of being institutionalized or they were being released and needed some kinds of a good and responsive plan. And also there was that concern about, Joe just mentioned, trying to move kids out of congregate settings because of the exposure to COVID-19 being so much greater there. So the majority of the cases that we saw involved children who demonstrated manifestations of trauma and adverse childhood experiences. So they had behavior problems that sort of categorized them as difficult. And early on in those child's experiences, they came to the system through child protection services. But over time, because of either behavior that they learned and how to coping with situations or symptoms of post-traumatic stress, they became a little bit more involved with child protection in terms of, the way parents were responding to them. So it might be a referral of abuse, it might be a referral of neglect, but at some point there's a crisis and law enforcement is called in. And even we saw cases where child protection were advising parents to call law enforcement when there's a crisis. And since we haven't established mobile crisis response yet, law enforcement was often responding to kids who were in mental health crises. So those cases shift over to juvenile justice, and this is what we call the crossover case. And this is essentially children are now shifted to a system that's holding them accountable. Where in child protection, the parent is accountable. And unfortunately, what's happening with the kids who are shifted into the juvenile justice side and being held accountable is that they may not have the capacity to be accountable. So they may have disruption of their development, they may have a communication disorder, they may just have post-traumatic stress disorder that makes it really difficult for them to follow along with the program. And so that's why you'll see kids taking charges even in residential programs and ending up getting in more trouble, and still a family who's not doing the work that child protection would require so that the whole family system is able to reunite and move forward functionally. So we're looking at those cases a little bit more closely to be able to respond in a better way. A second and related theme is the emphasis on treating behavior as a mental illness or criminality and not recognizing it as that communication disorder or a symptom of some developmental interruption or post-traumatic stress. So the system of care that's expanding right now, and it's even referred to as behavioral health, they're not really looking, we're not seeing partnerships with developmental disabilities. We're not seeing partnerships with people who are working with kids with communication disorders like physical therapy, occupational therapy, speech and language therapy, the things that you may get some services through school systems, but we're not otherwise offering outside of schools to help parents understand kids and work with them more. So that's getting really sort of messy. And we want to try to pull that out to make sure that there are better partnerships around a child with those varying needs. And that's exactly where the expanded jurisdiction is going to be helpful. There's one exception of some good news in all of this, and that's at the Sununu Youth Services Center, where they've contracted with Dartmouth Hitchcock for the services of a forensic psychologist. So Dr. Morin is not a behaviorist, but she does appreciate the positive pro-social approach to care. So we're seeing on a case-by-case basis at the Sununu Center that staff are being engaged and informed about positive ways of interacting and guiding children towards healthy behavior. So that's pretty promising, and we're hoping that we'll see more of that throughout the system. That progress is very slow, but we're pleased that the division recognizes how important that is. And a good example of that, just the idea of pro-social behaviors and supporting kids, and a big piece of it is respecting them, is that we learned from children that they were limited at the Sununu Center to 1 shower a day. And you could take a second shower if you earned the privilege. But if you don't have the capacity to follow the rules, you can't earn those privileges. And so you're sort of left without that. And, you could sort of understand that there are benefits to behaving and earning privileges, but I don't know that it's a privilege to sit next to a smelly, cranky teenager. And so what we were able to do was work with some of the kids and do some research for them on the benefits of bathing, hot showers, relaxation, better sleep, all that stuff, and also just feeling better about yourself when you're not stinky. And so they worked with Dr. Morin and with the director at the facility, and apparently now they're allowed to take more than 1 shower a day. And that's an accomplishment for their well-being, but it's also an accomplishment for them themselves. We're trying to work with kids across the state to be self-advocates and to be able to ask for things that they need. And so that was a good accomplishment for the year. In terms of incidents and deaths, if you saw in the annual report, we talked a lot about some of the things that we were seeing. Suicide, safe sleep, and access to firearms were 3 themes that we're hoping the Child Fatality Review Committee, now that it's up and running, will take those up as public health issues. Restraints and seclusion, we're preparing an addendum to last year's report about restraints and seclusion. And now that we're actually receiving incident reports, we're able to understand a little bit more. So we'll be able to talk a little bit more about what's happening. And we're starting to be able to send out alerts to facilities when we're seeing an overuse of restraint or seclusion, so that they can, dig in and try to understand what's going on with a particular child. We mentioned in the report that we had facility reviews underway. We monitored 2 DCYF investigations of the care of children in facilities, and then conducted our own at, so 2 of them were at Mount Prospect Academy and I'm sorry, I'm blanking on the facility that's now closed, Crotchet Mountain. And then we have our own review that's underway at Nashua Children's Home, because DCYF rolled their investigation back and are not investigating. So you may recall that the system learning reviews that we do include DCYF staff looking at how decisions are made. So as a piece of our review at Nashua Children's Home involved a restraint. So we're now going to be, our next system learning review is going to be around restraint at that facility. And for the first time, we're going to include facility staff and also Bureau of Children's Behavioral Health, who oversee placements in facilities. So we can start to build our circle around the situations to try to understand where we can strengthen the system and be more responsive to kids. And that all came out of an incident of restraint. In terms of COVID, Joe mentioned, we believe there's 31 current children who have been infected. As you mentioned in the beginning, there were children out of state, and now we're seeing it in state. And we also have a case of a child who was infected for the 2nd time. So that's something that's a little bit concerning. And I want to say, part of our messaging around this is that in general, across the world, when we're talking about COVID, we don't think of children quite as much of a risk because they don't appear to suffer so much from the disease acutely. They don't have the symptoms that many older adults will have. But the science that we're seeing around what the COVID virus does to your body, to your vascular system, to your neurological system, we're really concerned about the long-term effects that may be creating, pre-existing conditions for people who have been exposed to it. And we're doing a little research around that to try to inform people a little bit more. We're really pleased that the governor came out with the mask mandate. The only way that we can protect children is to wear the masks. There's some good evidence coming out that there's not a lot of transmission in schools. And so we should be able to keep children in schools, but the only way we can do that is to protect from community transmission, because that's where they're seeing where transmission is happening. It's in the community and not the school. So wearing masks is really important. The other concerns we have around COVID are, and we just met with a group of children in a facility last week. They couldn't talk about anything other than COVID, the fact that they're separated from their families. They're not able to continue certain therapies because it needs to happen in person. They're not able to meet and stay with potential foster parents or adoptive parents because they can't go and come back. The kids are really feeling that. And so there's a real interruption of progress to permanency. And Marty, you probably see that as well. Your CASA volunteers must be seeing that slowdown. We are told that that children are being allowed to make those permanency visits, but the facilities now with infections happening are really clamping down again at children going in and out. So that's really, it's hard to say what the long-term implications are going to be with that. Other than asking adoptive parents or foster parents to create a cohort and always be quarantining so that they can be safe for these kids to visit them. And this is an issue that we're really underscoring. Very important to get that community-based services infrastructure up and running. Joe didn't have time to talk about the community-based voluntary services program, but that's going to be part of it. And all of these programs are a long time coming. It's been really driving us crazy not to see them happening, because they're actually things that we plan to have a good system, but in fact, they're also COVID response things, because we know that people are supported in the community, then they do better through COVID. And we can't get them to places where, we can't put them in congregate settings. We can't bring them into the hospital. So having that community system. So that contract was just approved at GNC. There's finally an RFP out around some of the coordinating of the mobile crisis response. We want to see that move rapidly. There are other in-home intensive care programs that are supposed to be coming up for RFPs that are really important in supporting families at home. And we did make a proposal in our issue briefing about a creative kind of foster care that could be used for quarantining when kids need to move around. A short-term, 14-day foster care that may be more appealing to people who don't want to make the commitment of long-term foster care. And we'll be working with folks to try to create more conversation around opportunities for fostering. We think that's really important. And then you just had a little conversation about children backed up in the emergency departments. And there's a couple of things about that. Yes, we are seeing children with mental health crises, that the number is increasing, but there are also a lot of children who have never had any contact with the system before. So this is a trauma. The COVID crisis, the pandemic, is a trauma on all of us, and it's a trauma on children. And some of them are really having a difficult time. So when they come into systems, and this is what we're hearing from mental health centers and the emergency departments, they're brand new to systems. So they're parents who don't know how to navigate the system. They're children who have insurance, but they don't have coverage in their insurance for the kind of care that they need. So there's a big disconnect there that we have to try to build up. We need to get our community system built up stronger to respond to that. And there was a proposal that was sent to the governor, Deli Champagne just mentioned, about a way that we could use COVID funds to support families. And also, I will say that the Bureau of Children's Behavioral Health Fast Forward program is growing fast. And they are providing some good support for families. We need to be referring families over there so that they can help them sort of navigate how to best take care of their children. But I would say the key in that is mobile crisis response. These children don't belong in emergency rooms. They don't belong actually even hospitalized if we can get their families stabilized with them. And we really, with our expanded jurisdiction, want to be able to look at the individual cases of kids who are coming into the emergency room so we can understand what it is, why they're there, and what they need. We have had a couple cases come to us that weren't necessarily an issue of the child's mental illness so much as family dysfunction. They were crossover cases. They were cases of child protection that were turning into juvenile justice cases. That's how some of the kids end up in the juvenile system. There's a contract since New Hampshire Hospital closed their children's unit. They opened a contract with Hampstead Hospital that has explicit restrictions of which kids can be admitted at Hampstead Hospital. So a child who has criminal charges may not be admitted there. And the criminal charges may come from a child who's in a mental health crisis who hits his mother. And because there's no mobile crisis response, the law enforcement is called. And so the child now has charges and now has no access to that kind of mental health services in terms of an acute need. And so that's another area where if a mobile crisis response had been able to be there and deal with it, there wouldn't be charges. If the child did need to have acute mental health care, it would have been able to get into Hampstead Hospital. Or if it's something they could stabilize at home, then that would have been the issue. Because even think about being admitted to the hospital is another adverse childhood experience. A lot of these things sort of build on the child's negative experiences. So it's really important that we're building that supportive system at home. So we're hoping to look at those cases a little bit more closely once the commissioner is satisfied that we have the authority to do so. And we'll be able to bring out some sort of trends in that and identify ways that we can help those families. So that's basically, in a quick nutshell, what I have to say about the Office of the Child Advocate's work right now. I'm happy to take questions.
Senator Carson, did you call on me?
Yes, I did. Sorry.
I
Michelle.
actually have two questions, one related to what you just said, and then a sort of separate but related issue as well. I've been hearing a little bit from the public defenders that the enhanced residential treatment centers, which were originally designed as sort of alternative to incarcerations, have been being used more frequently for child protection kids. Is that related to the hospitals not taking these youths, and so they're winding up in this alternative to incarceration facility, or is that separate, or have you seen anything regarding that?
I mean, that's a great question. And in the contract with Hampstead Hospital, it does say that the Bureau of Children's Behavioral Health will manage those cases that are not allowed to go to Hampstead Hospital. But we can't really get an answer from the Bureau of Behavioral Health of what's happening, what they're doing with those kids, because we haven't gotten permission yet from the commissioner to, really explore that information. So, but we can guess. I mean, we have seen one or two cases where one in particular is absolutely a crossover case. It's a child protection case, but now there's a charge because a child has, thrown a telephone or assaulted somebody on the way out the door, or refused to talk to the police and ran from them. So that's resisting arrest. And so now that child is because there's also we're told that some of the residential providers are admitting, but there's been some slowdown in admissions because of the COVID. So people are being very careful. You can't quarantine everyone. So it's a mix of that. But I would suspect that that's what you're seeing. You're seeing kids who are getting into more trouble instead of getting into the treatment that they need.
And so sort of related, also related to the question I asked Joe earlier is, I'm really concerned about the lack of foster homes for the older youth. Have you, in any of your investigations, come up with any barriers to kinship placements, or is that something that you've looked at all?
Yeah, we haven't looked at it directly, but I can say that when we look at cases, we do see that there's a pretty good effort to try to find kin for children to stay with. I think that's been an initiative and a priority of the department, sometimes to the detriment of the child, because we're so happy to have a relative that we're not fully checking that out. But in general, I think that they've been pretty good about that. If you think about, though, if you've ever worked with children who have disabilities or complex medical conditions or serious mental illness, it's really common for those families to be entirely isolated, right? Nobody likes that family because that kid is a pain in the butt, right? Like, people are not comfortable. And so that's one of the reasons why those families fall apart, because they don't get any rest, they don't have any natural support. And so looking for kin to take care of this child who's really complicated, not because he's bad, but because no one has really thoroughly assessed that child and come to understand what is it that we need to do to help this child so that they can, go get along better and be able to live with each other. So it really comes down, part of Senate Bill 14 was about making sure we did this strengths-based risk assessment, making sure our needs assessments, like making sure we really understand children. It's not unusual for parents to actually want the kid out of the house. I mean, we get those calls. Again, DCYF won't take this kid from us. But in fact, when the child's needs are met, the parent can't believe they ever said that, because they're just exhausted. And so it's really a matter of understanding what the children need a little bit more and then making sure we have those supports.
Yeah, and that goes to your statement before around the intensive supports, because without the mobile crisis and in-home supports for both the families and or a foster home who's taking those kids with very challenging behaviors, there has to be someone they can turn to when they're at the end of their rope. And that's a critical piece of that system of care.
Yeah, that's a great point. Thank you. And we also, we try to get folks to think really creatively. You may have a parent who really can't cope. There are those cases where parents are being asked to be, they're being put in a position of have a finding for neglect against their child because they just can't keep it up. But you could actually be creative and put that child in a foster home for a while and maintain the relationship with the parent. So then eventually you have a built-in respite, whether they stay with the biological parent or whether they stay in a foster or adoptive home, but they still have those relationships because, generally parents are committed to their kids. They just can't, they just can't manage some of the care because they're not getting the right care either. So it really is about building support around these families and understanding the child, not considering them just mentally ill or just a criminal, but understanding of why is this child behaving this way? What is he telling us?
Let me make sure that I'm okay. Are there any further questions for Mara this morning? Okay, seeing none. Thank you, Myra. I know this is an ongoing discussion that we have because things are changing, and so hopefully we can continue this conversation at our next meeting. And you can probably update us. I know you're probably getting ready to work with the governor's office on a budget for moving forward for the next biennium and what your needs are, and perhaps we can discuss that at our next meeting.
Great, thank you so much. It's good to see
Thank
everyone.
you. Okay, next on the agenda is any additional business. Is there anything that anyone would like to bring forward to the commission this morning?
I have one thing.
Okay, I'm sorry, I only see like a few people.
It's Judge
Is this,
Ashley.
okay, good. Thank you, Judge.
I just a shout out, I think Joe is not back on the call, but he did ask the court if we would collaborate with developing protocols for SYSC kids, just so that they wouldn't have to quarantine every time they came to court, which isn't very often that they have to come to court, but if they do, the practice is that they have to quarantine for 14 days when they go back, which of course isolates them. And so we developed some protocols that would be, of course, very detailed with everyone being masked and careful and hand sanitizer, et cetera, but we had to cover it from not only the facility, but through the sheriff's transportation into the courthouse and back out again. And we received excellent collaboration from the sheriff's association. They were agreeable. Of course, I expect they're doing all of this anyway, but just having the system in place. So that's going to be in effect. They just needed a couple weeks notice. So that's going to be in effect the December 7th. So hopefully at that point, if everything is followed, when the kids do have to have an in-person hearing at court, they won't have to be quarantined when they get back to SYSC, and they can continue to engage in their normal activities there.
Great, that sounds great, and hopefully it'll make the situation a little less traumatic for kids, that they can just fit seamlessly back into where they're staying. Are there any other questions or comments? Marcia?
I just have a question. Is it possible to contribute to potential agenda items for our next meeting?
Of course.
And I'm going to put Judge Ashley on the spot, but I think this group would really benefit from learning more about the pilot project in Sullivan County for a family treatment court. It's a fantastic initiative that I know Judge Ashley and the courts have been instrumental in securing the 1.7 million for over a 3-year period from the Justice Department to create a pilot family treatment court. And it's so if we could put that on the agenda for next meeting, I think that would be a great idea.
Okay, I've got it down. So we'll get it on the agenda if Judge Ashley is okay with that.
Sure.
So, okay, terrific. Anybody at any time can make any kind of a recommendation. Just email me. Mr. Lapine will pick that up and we will get it on the agenda. So, yeah, okay, that's a great suggestion. Thank you, Marcia. Is there any other additional business to come forward? Okay, I don't see any. The other thing that I would like to add for our agenda for the next meeting, as you know, the legislature will hopefully at some point start meeting, and I'd like to start the legislative updates again. From what I understand, the House has filed their usual number of bills. And I'm not sure about the Senate. I think the last time I heard, and that was earlier this week, about 50 bills had been filed. So I think it's a good idea that we have some sort of an idea about what's out there, and we can talk about it in January. Okay. So is there let's look at another date. I was thinking sometime in January, in 2021, new year, hopefully things will be much better in 2021. What do you folks think about the 15th of January?
That is available on Zoom, Senator. The whole day is wide open.
Okay, the whole day is wide open. Does anybody have any objections to January 15th? Okay, I see head shaking. Okay, so why don't we schedule January 15th at 9 a.m. And right now it is a Zoom meeting, and that will probably continue. So we'll make sure that people have everything. And if you need something, please don't hesitate to email. Again, Mr. Lapine will be able to pick that up for me. And I'll take a motion to adjourn. It'll have to be a roll call vote again, but is there a motion to adjourn?
So moved.
Okay, so we have a motion and a second. Okay, is there any discussion? Okay, seeing none, I'm going to call the roll. Senator Morgan?
Yes.
Okay. Representative Grossman?
Yes.
Okay, Deli Champagne? Okay, Marcia Sink?
Yes.
Joy Barrett?
Yes.
Mary Ellen McKay?
Yes.
Representative Altschiller?
Yes.
Nancy Rollins?
Yes.
Judge Ashley?
Yes.
Michelle Wainwright?
Yes.
And Senator Carson, yes. So
And
thank you all.
Representative Petrino. I signed in about 5 minutes late.
Oh, okay. Well, thank you, Representative. We'll make sure that you're in the notes for being present. And
Yes.
Representative Petrino votes
Petrino.
yes. Petrino,
Yes.
okay. Thank you all. I hope everyone has a very safe and happy and healthy holiday season. And we will see you all in January.
Thank you, Senator.
Take care.
Thank you,
Bye-bye.
Senator.
Thank you, everybody.
Bye-bye.
Bye-bye.